Hi Lorenzo, my name is Ryan Espinoza and I'm a student at Owens Community College in the Physical Therapist Assistant Program, and I'm going to be working with you today. We're going to be doing a couple of stretches and some strengthening exercises, that way we can get you back to work and functioning properly. So today we'll just start off with the stretches. The first stretch we're going to be performing is a supination stretch, and that's this motion here. Okay, so it's just turning the hand over. I understand that you're having some lateral epicondylitis on the outside here, so we don't want to do any strengthening exercises, but we're just going to be stretching this today. This is going to be important to increase this range of motion for you, because when you're at work and somebody hands you a tool, you need to be able to turn your hand over, grab, and get back to using the tool. So the muscle we're going to be stretching out today is your pronator teres, and that muscle is right in this region here. It just turns that hand over. So it comes from like about here to here, crosses over the wrist. So you can go that way, and if this muscle is too tight, it won't let you effectively come back this way. Okay, so to perform this stretch, we're going to just place our hand up here like this. I like to go palm side out first. Then we'll just go and rotate into that supination position. And if you get stuck somewhere in about right this range, you're going to grab down here at the below the wrist. If you grab up here on your hand, you're just going to be, you'll effectively turn it, but you're just going to be working more your wrist. So I like to grab below the wrist and apply a slight twist over pressure. You're going to want to hold this stretch for 30 seconds, so we're going to be doing it 4 times today. What I don't want to see you do is, again, grab up at the wrist and try and rotate it. That also puts a lot of strain and stress on your wrist and does not feel good. So again, grab below and just twist. Okay, make sure you have good posture as always. You're going to try and maintain the upright posture, ears over the shoulders, and I like to do it from this flex position here, then just applying slight overpressure, and we're going to hold for 30 seconds. Okay, let's do one more. We're going to hold for 30 seconds. And again, you should feel that in that pronator teres. You'll be feeling the stretch on the back here, allowing you to rotate around some more. Be right in this region here. Okay. For our next stretch we're going to be completing is active assistive range of motion for your flexion. I noticed on your chart it's pretty low. You can only get to 127 degrees. Normal is usually around 150. This is also going to be important to improve. So you can bend your arm when you're swinging that hammer, and you can get more range, more power. It's a greater functional smack, okay? So again, as always, ears over the shoulders, shoulders pulled back, nice. And then you're just going to bring your arm up as much as you can yourself. You'll probably end up about around in this region. Once you get to there, you're going to take this hand and apply pressure and move it farther to where you're getting a nice stretch. And this is going to be stretching your triceps back here. This muscle is responsible for extension. And if this is too tight, so right here it starts to tighten up. If it's too tight, you'll effectively get shut off right here. So that's why we want to apply that overpressure and stretch it out some more. Okay? Again, we're going to hold this stretch for 30 seconds. So if we're going to complete a rep, we're going to go here. And then we're going to hold, hang on to that for 30 seconds. Okay, let's do one more rep. Hang on to that for 30 seconds. Just apply that slight overpressure. Make sure you're staying in a nice straight line. Okay, and then one more time. We're going to hold that. What I don't want to see you do is coming off to the sides. Here, just keep it nice and straight and hold. Don't want to see this and hold, because then you're not getting the triceps, okay, or coming out here and holding. Again, if you're noticing an increase in your pain symptoms while you're performing these stretches, you should stop them immediately. Same for the supination stretch. If you start to notice an increased pain in that lateral epicondylitis, you're going to want to stop this one. If you are experiencing an extreme amount of pain in the triceps while you're stretching, just back the stretch off or stop the stretch, okay? When we get my notes around for the strengthening portion, we're going to be incorporating some things, so I got to gather that around, and then we'll go on to the strengthening portion. Thank you. Okay, Lorenzo, now we're on to our strengthening portion of the day. Our first exercise we're going to be performing is extension. We're going to be strengthening that up. This is important for you to increase this. That way when you are swinging your hammer, doing your carpentry work, you'll be able to get a nice good smack, okay? So for our first exercise, which we're going to be doing, is a tricep extension. So you're going to want to maintain that good posture, as always. Ears over the shoulders, shoulders over the hips. Make sure you pull them shoulders back and the head back. And you're just going to grab onto this elastic tubing I have here. And you're going to want to make sure that you're going into a straight line. So you're going to be standing nice and tall, good posture. Then just extending that arm straight back, okay? This is going to be working your triceps muscle here at the back. The reason why this muscle is responsible for elbow extension, so for straightening your arm out. So again, you're going to want to maintain a nice straight line. We're going to do three of them here. So right there is 1. Come down 2, 3, 4. Okay, what I don't want to see you do is not having your elbow. What I don't want to see you do is not having your elbow tucked tight to you. Okay, so keep it nice and tight, close to your body. You're going to come down, straight down. Okay, I don't want to see a sideways pull outward or in closer to you, because then you're not going to be effectively hitting your triceps. Okay. So I'll show you a sideways view here. I'm not effectively pulling straight, but this is just so you can see the sideways view of it. You're here, then extending straight down, okay? So just like this, then straight down. You're going to want to stop this exercise if you do notice an increase in pain symptoms of your elbow. Now we're going to go on to our next exercise that I have planned for you, and that is going to be a pronation exercise, okay? So this is going to be working on the pronator teres, which is a muscle that runs from here to here. So it kind of does this diagonal line. So when you contract it and shorten it, it rotates that wrist over, okay? The reason why we want to improve this for you, if you're doing your carpentry work and you're having to use a tool like a screwdriver and you're rotating and twisting it, you'll have the strength to do so, okay? So to perform this exercise, always going to want to have good posture, pull the shoulders back, okay? Ears over the shoulders as always. I like to prop myself up on something here, nice and flat, so you're nice, flat, and straight. Just like that, or you can perform it out here. Okay, but just as long as you're maintaining that good posture. Okay. So we're going to take the weight, and you're going to start off here, palm up. Place the weight in your hand. Okay, and you just turn that wrist over. Okay. Now what I don't want you to do is just pull it back on your own. Okay. This supination motion is really going to affect that lateral epicondylitis. So you're going to grab the weight, bring it back to neutral yourself, and then pronate. Grab the weight, bring it back to yourself, pronate. When you bring it back, I don't want to see you using any of these muscles on the outside here, okay? You're just going to relax the arm, bring it back with this one, okay? So again, keep everything in a nice straight line this way. Just pronate over, grab it, pronate over, Keep the elbow quiet, everything there. Just let this hand do the whole work, okay? And if you're noticing that this is too easy for you, you can increase this by grabbing the very outside edge of the weight here and then coming over. Okay? Grab this, bring it back over. Okay, what I don't want to see is you way out here with your elbow and performing this exercise. I also don't want to see you bringing it back over yourself or even getting offline this way and coming over. It should just be a nice straight line and then over. Okay? If you notice an increase in pain symptoms of that outside elbow, you should stop this exercise immediately. Or if you're noticing an increased pain symptoms when you're coming back, that means you're effectively activating these muscles and using that too much. So just make sure to keep that elbow quiet, bring it back over, and then go from there, okay? So that is it for our strengthening portion. I appreciate the time, and hopefully all these things can help you out. Thank you and have a nice day. Okay, Lorenzo, so before you leave the clinic today, I just want to share your HEP with you. The first stretch I have on here is the one where you're passively raising your arm up to you. Okay, again, remember you just have your arm on the table in a straight line like so. Bring it up as far as you can go and then apply that slight overpressure. Okay, if you have any questions before you go, now would be the time to ask me. And also before you leave, can I have you show me 1 rep of that, please? And then for our strengthening portion, my printer isn't printing off the picture that I have, but it's the one with the hammer. You have your arms slightly off the table, and you just pronate over. Again, you're going to want to assist it over for yourself. Keep everything in a straight line this way, and then just pronate it over. Okay, if you have any questions before you go, now would be a good time to ask me. And also, before you leave, could I have you repeat 1 rep for me, please? Yep, looks perfect. Good job. Just going to keep doing it just like that, okay? I appreciate it, and remember, just stick to this here. For the stretch, I have you performing that, holding it for 30 seconds, 4 times each time you do it, and then you're going to do it 2 times a day, 4 times a week, okay? And then for the strengthening portion, I have you doing 5 total sets with 6 reps each in each set, 2 times a day and 3 times a week. Okay? Awesome. Thank you.